Now, the Oregon Health Authority, we were talking about it off the top, they're changing the way it reports deaths. For 11 months now, the state has given us detailed information about each person who died. Now, essentially out of nowhere, the state says it's changing what we get to know. And even before we reported this development, we started hearing from some of you at home, like Bill, who said, "Hey, Dan, I hope this is not a veiled attempt by OHA to cover up the number of seniors that die, while the governor prioritizes educators and others ahead of seniors who have experienced the greatest death rate for the COVID vaccine." Given that OHA has been producing this data for months, why wouldn't they finish this project so that there is consistent data set across the entire pandemic timeframe? And it is a good question, and our Kristen Severance set out to answer it.
We heard from story viewers like Dennis Gavin and Sarah Thomas as soon as the state announced a change in the way deaths would be reported.
To me, there's a perception of that they're hiding information now. They don't want to report the people over 65 because they have decided to favor the school teachers, even though schools have no plans to open in the near future.
Since March, the Oregon Health Authority provided a person's age, county, location of death, date when they tested positive for COVID, and the date when they died, and if they had underlying conditions. The state did this in the spirit of transparency after Governor Brown told the agency to release all COVID-related information with the public that doesn't compromise patient privacy. Now the agency will show all the deaths on these charts. An age range will be listed, but not the person's gender, where they lived, when they tested positive, when they died, and if they had underlying conditions.
Information is easy to come by, easy to put on site. You do it every night. You quote statistics all the time. It's not like it's hard for them to put it on. They've been doing it for months.
The Oregon Health Authority told me verifying each death certificate was too much work for their epidemiologist. The change had been in the works for a while, and the dashboard will still give an accurate look at the data. Shireen Tagarobi is an attorney with the First Amendment Coalition, a nonprofit pushing for a more accountable government. She said states should be releasing more data, not less.
Especially right now during this pandemic, the government is wielding extraordinary power, right? The power to close people's businesses, the power to affect their livelihoods, and ultimately their lives. And so the government and local authorities owe it to the people to disclose as much data as possible about what's driving those decisions that are ultimately so affecting people's lives.
And especially when Brown is under intense criticism for putting teachers ahead of seniors in the vaccination line. The way the deaths will now be reported, we won't be able to see exactly how many seniors tested positive and died while waiting for a vaccine.
I think, like him, I'm suspicious that they're not doing it because people got mad that the teachers bumped up over older people.
It's disingenuous to say that it's too much work when you're only reporting maybe a dozen people at a time when they come in. It's not like they're reporting hundreds or thousands like in other states. So it just appears that they're covering up because we are one of the few states who is not vaccinating people over 65 right now.
A spokesman for Governor Brown told me this was an internal OHA decision. But he said OHA will still be able to release information about COVID deaths, including an age range. That is true, but not specific details like how old the person was, where they lived, when they tested positive, and when they died. Dan?
Kristen, thank you. And before we move on here, I do have something really quick to say about this. See, the head of OHA, Patrick Allen, said in a statement that, quote, every death from COVID-19 represents a loss, especially for those who knew them best, families, friends, and loved ones. And that is why we have listed each case. And I kind of was surprised by that. I didn't realize that. I thought it was so that people knew what you knew, the OHA. Because those families are not the only ones interested in that information that you, the OHA, hold the keys to. And I'm not sure if you've noticed, but people are paying a lot of attention nowadays to the ones holding the keys, right? From BLM and the relationship with police to business owners shut down by the governor to how COVID deaths are classified and counted. People have made it very clear that they want transparency. And we have seen time and time again, when the people in power leave us out of the conversation, misinformation will fill that void, and that spreads faster than any virus. I'll admit, I'm biased here. I'm a journalist. I don't like being left in the dark, so I recommend you keep the lights on.